Commissioners Board work session. It is Wednesday, April 20th, 2022. It is 2:01 p.m. This is set to go until 3 p.m. This is a hybrid meeting in Building 1, Room 280. For public attendance, you may dial in at 360-252-9020, pin number 1234, or follow along on the Thurston County YouTube channel. I'm Carolina Mejia. I'm the chair of the board. I'm joined by Vice Chair Ty Menser, as well as Commissioner Gary Edwards in the boardroom and County Manager Ramiro Chavez. The topic for today's agenda is pollution identification and correction PIC system. And members of the public health team have joined us today to give us this presentation. So who am I handing this off to?
Just an introduction, Madam Chair. This is a continuation of briefings related to the PIC. I'd like to characterize this as a series of meetings. So we are on season 2, episode number 1. Go here, Art.
Okay, I'll have to change my some of my slides then to reflect that season 2. But anyway, so welcome to season 2, episode 1. I'm here today along with several of our other staff, including some folks I don't know that you've met them before. In fact, I know you haven't for a couple of them. And we wanted to give you an update again on the pollution identification and correction work and our septic system monitoring and maintenance work, as well as some of the efforts we're making to respond to some of the priorities that you've identified in our previous briefings, and as well as show you how we're trying to move forward with some of your budget decisions that you made last year when when the use of the foundational public health services funds, the kind of a primary focus of that was to work on some of this PIC stuff. So I think we've got some pretty good news, and also some want to give you some indicators of what's coming ahead. So I will now attempt to share my screen. And here we go. So is everybody seeing that?
Yeah.
Okay. So again, here's the title slide. And we're back. And you've seen this slide before too. Again, just want to give you some updates on some things that are going on. So we're going to be talking again about our foundational public health services funding and how we're going to use that. Some activities, some pollution identification and correction enhancements that we're taking on this year, both as a result of grant funding, as well as some of the use of the foundational public health services money. Talk a little bit about our staff. We have some new staff, a couple of whom I'll introduce here in a second, as well as the work that we're going to be doing on Black Lake, our work on on-site sewage system, or OSS compliance, or call them septic systems if you prefer. And then also what's coming up ahead is the Nisqually program. And before I go any further, I should mention who our staff are. I'll jump ahead here. We do have a couple of folks who are going to be presenting part of this, and they're shown here on the slide. So there's Sherry Jones. Maybe Sherry can say hi.
Hi, everyone.
And then also Maggie Morehouse. She's one of our O&M stars. And then the other folks who are here today, I think you've recognized most of them, but Steve Peterson, Jane Mountjoy-Venning, and then I believe you've met him before, Stuart Whitford. Stuart Whitford is our program manager in our water quality and septic system O&M program. He's been here for 6 months and I believe 3 days. And so Stuart has a lot of experience working on pollution identification efforts and septic system programs in both Kitsap and Jefferson County, and also working for the city of Shoreline. So we're really pleased that we've got this crew here today to help present this. And I'll come back to this slide in a minute. So the things that we've talked about over the past bit and the priorities that we've identified here are on this slide. So we're trying to develop programs and bring together resources to follow up on the problems that we've seen with inspection reports. I think we've mentioned before that when a septic system professional pumps a septic tank or does an inspection on a system, they're supposed to file a report using an electronic system. We receive those reports, and then there's ways that problems are identified, and we've had a tough time keeping up with those. So there's been some problems that have been reported that were pretty significant, and we haven't been able to get to them all, but now we're making some concerted efforts on that. So that was something we identified. We want to make sure that we try to do our best to make sure that the number of systems that have current inspections, in other words, they're being regularly monitored and maintained, we want to improve that. We were doing really well in some areas, and some other areas of the county that we're not doing so well. Of course, the priority with all of this is to make sure that when we have failing septic systems, particularly those that are posing a higher risk to the community when they fail, typically along the shoreline, or those that serve large populations or located in vulnerable areas, that we find those and we get those fixed as quickly as possible. And a big piece of that, of course, is to make sure that the owners of those systems know what to do, how to monitor and maintain them, where they are, what type of system they have. A lot of times people move into homes and they're really not sure. We still get phone calls to this day with people who say, I don't know that I had a septic system. Or sometimes even the converse, they don't know that they're on sewer. So we want to make sure that they have the information that they need, and to provide incentives where we can to get people to do what's necessary. And so we'll talk a little bit about that. The other thing that we try to do is to respond to reports or studies that identify water quality problems, especially those that seem to be of public health significance or maybe related to things that are clearly our responsibility, like failing septic systems. We look at a lot of other things too, but sometimes when we identify the problem, we find out it's not the septic system. And if it's not our domain, we'll try to help people who have the responsibility or the authority step in and work on those. But a lot of times it is something that we can deal with, whether it's a septic system or it's some other element that's covered by one of our sanitary codes. For instance, we have a sanitary code that deals with non-point pollution. That could be things like animal waste or things, maybe that falls back into our domain, and we'll have to work on that. And of course, it's important to be, and you've said this before as the board, is we want to be fair and equitable. And we want to make sure that the public understands and hopefully supports our programs. If they understand things, we're being fair and equitable, it's more likely we'll gain their support, and that's really important. So coming up this year and next year, we do have some activities that we're going to use foundational public health services money to support. Clean water surveys, and we've started those in a couple of watersheds to determine the source of pollution that's impacting our streams or shellfish areas or threatening growing areas. Evaluating contaminated streams that discharged to Black Lake last year. You heard a whole lot of people come and talk to you about or send you email and correspondence about Black Lake and concerns that they had, and a study that was published that identified some problems, and they were wanting us to, as the county, to do more. And based on with Foundational Public Health Services and with a new grant that will be coming in at the end of the year, we're going to be able to do quite a bit. Stuart will be talking about that. And following up on those septic system reports that indicate we have problems. We're both using Foundational Public Health Services money as well as some grants to do that, and that's something that Sherry and Maggie can talk about along with James. So we've got some interesting story or two about that. Just for to let you know who we are and what we're doing. We've got all the interim people in here too. So we've got both Kurt and Ramiro, and we have the water quality program that's Stuart manages. He manages both. He manages or supervises these folks directly, and he also supervises Jane, who supervises these folks. So you'll see that Maggie and Sherry are in this group. That's the septic system monitoring and maintenance group. And then we also have the water quality group that do a lot of monitoring and problem evaluation on shorelines, things like that. So that's our crew, and there's a few vacancies there, we're hoping to be able to fill those soon. Any questions so far?
Yes, but I don't know if are we going to do questions now?
Yes.
If there's I'll let the chair speak.
Go ahead, Commissioner Edwards.
How are we doing on the camping club? Is that appropriate for this time?
We can talk about that, but we had a meeting just this morning with the folks from the camping club to talk about options for bringing that system or those systems into compliance. I think it was a very successful meeting. We can talk about that a little bit more in detail. Stuart and Jane and Steve and I were all there, along with Maggie, and I was actually quite impressed. So it's not permanently fixed, but they've taken steps to make sure that the immediate problems have been addressed. And Maggie or Jane can correct me if I speak incorrectly. And they're now embarking, they've hired a septic system designer who is now looking to develop an option for a more permanent solution to the problems there. They've got, I think we've talked about this before, about 200 homes or 200 sites out there. Several of them, about a third of them, are occupied by people who reside there anywhere from 60 days to 359 days a year. I think they have to have at least a 1 week lapse in there, and then another 100 and whatever, 2/3 of 200 is 135 or so that have people there at sometime during the year that might be truly recreational. But they all have holding tanks. And when we started doing this work a few years ago, we found that several of the holding tanks were in really tough shape. They had poor connections. They were leaking. Some people were discharging things inappropriately, and they've got that part of it fixed. But now we need to come up with something that's more reliable and sustainable.
Tell me, Art, just if you had to guess how many holding tank pump outs take place there on an annual basis, what would you tell me?
I could speak to
Jane will be
that.
better. Yes, Jane, Maggie, help me, please.
So one of the things that we have implemented, and the camping club has been very cooperative, is they have started a monthly inspection of all the tanks themselves to ensure that there's nobody discharging from an RV straight to the ground, even if it's gray water. It all needs to go to a tank. The way their system has been working is the individuals, when they're ready to have their tank pumped, leave a check in the special box, and the pumper comes once a week on Tuesdays and pumps the tank. But there wasn't tracking from the camping club itself, and we didn't get that information. So one of the things, Maggie's actually going out with them next week to meet with the manager of the park to have include that information on a monthly checklist that they'll have to submit to us each month. So we'll have a much better idea and be able to track that much more closely than we.
How much are they charging for a pump out?
I'm not sure. That's the pumper. The tanks aren't very big. They're about 250 gallons.
Right, but I mean, I'm curious, the honor system works sometimes, but sometimes it doesn't. So
Right.
I'm just curious. What about on one of your bullets when you first started, assure the shoreline issues and stuff? I'm hoping that those are prioritized as the #1 issue you look into, because you said you can't keep up, Art. I'm curious why you can't keep up, but if you can't, I hope you're prioritizing where the problem might be the worst. That's why I'm going to the camping club, actually.
Right. The shoreline stuff clearly are priorities. And the reason we couldn't keep up is because, frankly, we didn't have all the staff that we needed. But now we're largely staffed up, and we've been able to shift things around so that Sherry is focusing a lot of her attention on following up on these monitoring reports and things. So that's a big success for us as well. And I didn't realize that Vladimir's on the call too, but Vladimir and Maggie are following up on the pumping reports and the monitored systems. You might recall that a lot of systems in the county, especially those in Henderson and Nisqually, and the complex systems have to have a monitoring specialist, and they have to turn in reports. And So Maggie and Vlad do a good job of following up on those. So that's the work we're doing. But you're correct, Commissioner Edwards, that when we find a failing, or we hear about a failing system or problems near a shoreline area, those are the big priorities, or those, along with things like, if it was a daycare or a school setting or something, we'd certainly jump on those first.
What about immediately downstream of the camping club on your water samples? How are we doing on that?
We still have elevated samples, and our PIC team, and Stuart might have the most recent data, I'm not sure, has also been finding that water in the creek entering the camping club also has elevated bacteria, which back when we were doing this a few years ago, most of those samples coming into the creek were low and got higher in once it went through the camping club. So we're also doing some investigation up in the farmlands upstream of the camping club, as well as the changes in the camping club itself.
Did you ever identify through DNA testing or anything of that material coming in from upstream, which was, if I remember right, was suspected ag activity versus human activity from the camping club?
Sure.
Well, this is Stuart. I could answer that. So what's happening in the bigger picture, what's happening is as you guys know, we have a countywide ambient monitoring program for lakes and streams. And so the streams that have the highest E. coli bacteria concentrations are being segmented so we can figure out, the different segments that are causing the pollution. So one of those is Dobbs Creek. And so we've pretty much finished the segmentation and the monitoring. And so we know that coming into Pleasant Forest, the E. coli concentrations are very high and about the same as they are leaving. And we know that there are sources above, like ag and other sources. We also, this morning, were told by a designer there may be a failing septic system up in there somewhere, but no, not yet. We've not done the analysis to see what the source of that is, but we do have tools available to us, to do that, which we will be doing in the near future.
Commissioner Menser, you have your hand up.
Yes, I was curious about the map and how this maybe connects to the TMDL presentation we had about the Deschutes. There looked to be some pretty rough areas on a whole bunch of different parameters up and down the Deschutes, and I'm wondering why wouldn't there be a priority area on the Deschutes River for PIC?
This is Stuart. So primarily because the bacteria concentrations are not as elevated as in other areas. And so that would be the primary reason at this time.
But that is, as the program evolves and we can solve some of these problems, well, we can work on that. But it does come down to, I guess, you could call it a budget situation, where we have so many resources and so many staff, and or only so many resources and staff, and trying to decide what our priorities should be based on the resources we have. And we haven't, at this point, spent as much time on the Deschutes as we would like to do in the future, but the areas shown here on the map are our current priorities.
I just want to make sure that there's because I hear, and you guys can help me answer this. So I hear sometimes a belief amongst citizens that these areas, and take Black Lake out of it for a minute, but those areas, because there's aquaculture interest, there's big money interest at stake, that's why those areas get priority. And I don't really, I struggle to answer how to counter that. If it's based on data of, fecal coliform or whatever, and that just happens to be where the problem is, then I can point to that. But that's kind of why I'm asking the question. Because I hear that sometimes. I don't have a good answer for it.
Yeah, and so I think the priority areas that we have identified are based on water quality problems. As Stuart indicated, we're following up on Department of Health's marine monitoring work, or other things, or our ambient monitoring that shows where we have impaired water quality. But there are probably others within the county that we haven't gotten to or haven't gotten to yet. So we're trying to do what we can with the resources we have. And again, just looking at this map here, you can see Totten Inlet. And you're correct, though, a lot of when you also look at the consequences of having water quality problems, there are very rigid requirements and there are pretty severe consequences if we fail in marine areas. I mean, we can have downgrades that then have lots of impacts to both the citizens and the county. So we do, I'd be lying if I didn't say that they're one of the big priorities.
As well as some of our funding until this Foundation of Public Health funding came along, has also been driven by National Estuary Program grants, which are Puget Sound based. And so we could only use them in shellfish growing areas to do some of the work. So that's a funding issue.
Jane, I'm glad you brought, so that's really what in my head was really driving that. And that's why I thought, okay, this money that we've got now should allow us to be able to depart from those areas that are limited by those grants and go to other areas in the county. So that's why I think it caught my attention that this map still seems to be focused on the same areas.
Yeah.
Because I want to be able to expand into other areas that wouldn't qualify for that other funding.
And that's, I think, a really good point. And one of the things we're going to have to do this coming year, with your help, is look at what our next areas might be. Because when we first talked to you last year, we didn't know that we were going to receive a significant Black Lake grant. Well, we've got that now. And so that actually then allows us we'll probably have, and we'll also looks like we're going to get some additional foundational public health services money that's earmarked for environmental health. And we then might be able to, well, then we need to decide what do we do next. And do we continue to focus on pollution identification activities, or do we want to invest in some other program? Environmental health, there's other things that it could be spent on, but the Deschutes work could certainly fall into that.
One more question. On your first slide about activities, you say clean water property surveys to determine the source of pollution. I guess it's number 5.
Okay.
Yeah.
Like from a technical standpoint, what does that mean, a property survey? Like how do you determine this? What does that mean to do a property survey and determine the source of the pollution?
Well, this is Stuart. I can answer that question. So the clean water property surveys are actual inspections of properties that are associated with hotspots for E. coli bacteria. So for example, if we use the Black Lake, example, and, say, for example, there's a, contaminated stormwater, discharge, we would want to, visit each of those properties that border that, individually, provide education, outreach, help them kind of identify any potential sources on their property that might be causing it and work with them to get those things corrected. Or in the Totten Inlet shoreline survey scenario, we're actually currently walking the entire shoreline of Totten Inlet in Thurston County, collecting samples of all flowing discharges to it. We confirm E. coli bacteria hotspots. And once we have those confirmed, then we identify homes or properties that may be associated with that. And then we actually just go out and knock on doors and visit with people, meet them on their property, provide a copy of their records, educational materials, and basically ask for their help in doing the investigation. And that's where the beauty of the process is, because most people, once they hear that there is a hot spot near where they live, they want to kind of figure it out. And of course, they like to point fingers, at neighbors, but it's a good process. And so that's what a clean water property survey is.
Cool, thank you.
Sure.
Thank you.
Okay. So again, here's some of the highlighted areas, or the areas we're focusing on, and going to talk a bit about Black Lake now. So this is one of the priorities, and again, we're attempting to follow up on, not attempting, we will be following up on the work that was done by or paid for by the community association or the lake management folks. It was done by Herrera. And this is a chart or a map from their presentation, or their study that I updated a little bit to show the high priority sites. And you can see there's 3 areas And this one is adjacent to, or is a pipe or a ditch that comes from a high density area. And so part of the things we're going to be doing is working with the community out there to identify and correct problems if we can find them. And do you want to talk a little bit about this, Stuart?
Oh, yeah, sure. And actually, it was Jane that wrote the grant application. It was a great grant application, and it ranks fairly highly. It'll be a $250,000 grant, and that requires a 25% match. But because of the foundational public health funds, we can associate more money with this project, because what we want to do is deal with this all at once in a holistic approach. So in the past, I have experience I've had 26 years of experience doing PIC projects in Kitsap and Jefferson County. I've worked on 2 different lake projects that can be very challenging. One was Long Lake in Kitsap, and the other one, Kitsap Lake, which is an urbanized lake in Kitsap County. Both of these lakes had tremendous issues with cyanobacteria blooms and also contaminated stormwater. So basically, as we mentioned, we know of already some hot spots for bacteria, and also evidence through sampling for human bacteroides, which is a way to associate E. coli with the source, that there's some problems, going on there, or at least at 3 different locations. So we'll be investigating those for sure, but also, in addition, we will be probably at summer low flow, and other times we'll be collecting more samples of anything that's discharging, to the lake, to evaluate those for E. coli bacteria concentrations and probably human bacteroides. And from there, we'll investigate properties that are associated with those, but also the goal is to really try to get to most of the homes out there with a clean water survey. What we find with PIC, state, Puget Sound wide, is that the more homes we can reach, the better, because you have an opportunity for one-on-one education with a property owner. In most cases along lakes especially, the participation rate is very high because most people are invested in the lake. They want it to be healthy and safe, to contact. And so we expect a lot of community involvement and, and support, as we do that. So yeah, we're very excited to get that going. And there's some other things here in addition to the clean water visits. We have we'll be doing an incentive program. Can you go back to the other?
Okay.
Yeah, for riser rebates, hardship, small grants or loans to encourage monitoring, obviously training, pet waste stations. We may have pet waste stations out there already, but additional ones, if necessary. And maybe the next slide too, if you could, yeah. So part of that, as you mentioned, PIC is reviewing the historical data and reports. I mentioned additional surface water monitoring to identify hotspots, investigating those hotspots. And as mentioned, there's a couple of techniques we can do to see if there's human impact in those hotspots. That's the human bacteroides, and also chemical emerging contaminants, which are typical things like sucralose and caffeine, and other things that we can actually sample for. That tells us that at least a portion of that hotspot is due to human contamination. And then we can take action to correct problems that we find. And of course, that always could involve dye tracing, improving a septic system failure, and then, through education and enforcement, getting that corrected.
So, it looks like there's a lot of neat opportunities here. Like Stuart indicated, the field of doing source identification is changing, or at least it's advancing. And so using bacteroides, which he could describe in more detail than I can, and some of the other chemical contaminants allows us to make or differentiate or make sure that what the source is. Because as Commissioner Edwards and others have talked about, when you're just looking at nitrogen as an example, there's lots of things that discharge nitrogen. When you're talking about fecal coliform bacteria or E. coli, there's different things that emit or excrete E. coli. But if you have a way to differentiate whether it comes from humans, which is what the bacteroides does, or if you can find a chemical parameter that's associated with a particular activity, whether it's humans or stormwater or different types of animals rather than humans, that can help you pinpoint the source. And as we've said before, we really want to make sure we're correct when we ask someone to fix something and spend money. It'd be really bad to have someone rip up their yard or replace a septic system and then find out that, well, actually it was doing okay, and it was a pipe from the neighboring property or something else that was really the source of the problem. So we want to be sure before we ask people to make big investments. I mean, this is just a slide to show you where one of the neighborhoods. So this is the Evergreen Shores area on Black Lake, and here's whoops, I got the wrong thing here. Sorry. Sorry, I don't know what I'm doing. This is the area where one of the monitoring by Herrera indicated high levels of E. coli bacteria, and you can see all the homes nearby. And that neighborhood actually extends further down off the slide. So there's several hundred homes that are and you can't see very well the different stormwater conveyances and pavement and stuff that probably is contributing to this discharge over here. So that's going to be the trick, doing the clean water surveys that Stuart's mentioned and the water quality evaluations to see what all is draining to station number 3, and then I did work with the property owners to see if we can figure out what's causing the problems. But the first step, of course, is to be able to verify that the problems are still occurring. We suspect they are, but that's also the first step, is we need to act based on facts and current data. And so again, if we're asking someone to take steps to fix something, we need to be certain that there's something that needs to be fixed. So the next bit, we're going to talk a bit about septic system monitoring and maintenance, and kind of remind folks of some of the stuff from the past and some of the efforts that are going forward to make sure that people can monitor and maintain their systems appropriately, and when there are problems, what we can do to identify and fix those. So Jane, did you want to cover these?
I do. Hold on. Okay, sorry. Yeah, this is kind of a refresher slide with updated figures. We now have a little over 55,000 septic systems in the county. And we actually moved that line from 50% to 51% of folks who are current in their having an inspection or pumping done, having maintenance done. Again, just a reminder, somewhere between a quarter to a third of the systems require these renewable operational certificates. We call them OPCs. And those folks do a grand job of keeping current with their inspections, because we require them to, and we need them to turn in their inspection reports. And that's where we have focused our energy on following up with people to make sure that any deficiencies that were noted in those septic reports are corrected. And that's the work that our septic operations and maintenance team do. Then there's the other, a little under 0.75%, so about 71% of the systems in the county that do not have renewable operational certificates. And out of those guys, only 36% are current for having inspections done every 3 years and turning them into us. Now, there might be people like myself and Art who have septic systems that don't have renewable operational certificates, and we inspect our systems regularly, but we don't report to the county because we haven't been asking for that. And there's not really a way to do that just yet. But we do know that, again, they're not as, in general, not as current. So one of the things, next slide, we've been able to do is we took a look at those reports that were coming in and what kind of, how many deficiencies, what kinds of deficiencies we're doing. We worked with our computer guru, Joel, who can do things in Amanda that others of us can't do, and program things. And he created a report to help us locate or pull out the serious deficiencies. And those would be deficiencies that could really indicate that a system was failing. Things like surfacing sewage or Tank levels weren't correct, which might mean they're leaking. And there's a series of them. So looking at those, we found a pretty high percentage of inspection reports that came in that indicated that there were those deficiencies. Again, we're only getting reports at a routine level for about half of the systems in the county. So the other half, could have this level of these kind of percentages, but we don't really know. So next slide.
Yeah,
So
just a reminder, this is a little bit older data. We're working to update the information. But we picked 2019 because that was pre-COVID, and that was the last complete data set before COVID, and we're not quite sure what COVID's doing to everybody as far as their maintenance.
Right. And we're also looking, it's pretty complex on some of this, and so we'll be updating the criteria that we're looking at in our future reporting to make sure that we're comparing apples to apples going forward. Yeah, next slide. So again, deficiencies and failing septic systems, it can look like surfacing sewage like you see on the top, and the big slide on the right, it can look like a big mess. And if you notice that, most people do tend to take action, but not always. Sometimes something like the one on the left maybe goes unnoticed, especially if it's in an area of your yard that you just don't go to very much. But failing septic systems can also look like the picture on the bottom there, where the baff or the pipe coming out of the tank, the tank itself has corroded enough that now you've got leaking sewage. It's not going to the drain field for proper treatment. It's just leaking into the ground. So those are ones that are less obvious to a passerby, but still create public health problems. So that's, again, the regular inspections help identify all these kinds of situations to follow up on, and then as well as responding to public complaints when somebody says, my neighbor's yard smells really bad and there's this weird stuff that's coming over the fence into my yard. So can you come take a look? Next slide.
That was one of the questions I was going to ask, Jane. I was like, can't people tell by the smell? Like, maybe not by, they can't see it in their yard, but I would think the smell would be a giveaway.
Yeah, often it is smelly, and that is a good giveaway. And we get complaints about that. So we do go out and follow up on that.
Like Jane indicated, though, sometimes these things will be failing in an area away from the home, and people don't even notice it for a while, or may not notice it at all. And then some of these you don't. The other thing I don't mean to butt in, Jane, but years ago when we did some really did quite a bit of analysis of our septic system failures on the marine shorelines, we found out that about half the time when we found measurable elevated fecal coliform levels or E. coli levels on the shoreline, they were because of things like this, where there was a leaky pipe or a loose fitting or something. And you might think, well, how does that get to the shoreline? Well, the thing is, a lot of times the septic tanks are close to homes. They might be in areas where the soils are poor because the drain field's in the good soil area. There are drainage systems typically around homes, footing drains. There might be property things running around drainage systems in the property that are maybe away from this drain field, but next to the septic tank. And so when this stuff hits or starts leaking out, and it then has once it goes a few feet, it gets caught up in a conveyance system that takes it down to the shoreline, because that's where you want all your stormwater to go, or at least that's where a lot of the systems are designed to go. And once the bacteria get into that system, they aren't treated very well at all. So it can be pretty nasty. So here we go.
Okay, so with the Foundational Public Health Funds, we've been able to add a position, which has been great. And so Sherry, who's going to speak in a minute, she was already with us, but she shifted over to focus on compliance, and we're backfilling her position, and that person starts in 2 weeks. Yay. So again, we had a backlog because we hadn't been able to get to those deficient reports that didn't have renewable operational certificates very often. And so we had a big backlog. Looking back just a year, we had over 200 reports that needed to be looked at. Again, things that were indicating that they might be failures. So to narrow it down even further, because Sherry's just one person, is working full time on compliance now. So we're starting by going back 6 months and keeping up with current reports as they come in and current complaints as they come in, and then following up on older reports as time allows, older deficient reports. And then, as mentioned earlier, we definitely prioritize our response based on the type of deficiency and the location. So surfacing sewage, that's a high priority. We want to get out there, ideally within the day or within, a couple of days of receiving a report about surfacing sewage. Areas that are shellfish growing areas, those are high priority because of the multiple public health impacts to a wide variety of people who might be eating that shellfish. We also look at high density, say apartment complexes, the proximity to public access, such as say a school or a park, or again, if we know it's a childcare or a vulnerable population, that's a high priority. We also look at designated wellhead protection areas, or say Summit Lake as their drinking water source. Those kinds of areas that have increased public health risks, we respond to those as a higher criteria, higher priority. And then, Sherry puts her route together, but if she's going out somewhere based on some of these things, and there's a few others that are in the neighborhood, we'll pick those up as well. Next slide. So Sherry shifted this into this new role on March 1st. So we've had, 6 weeks thus far of working on this full time. And so far she's investigated 120 reports. Now this was when we turned the slides in, so it's probably more already by now. We had 35 confirmed problems, again, that we could verify that, yep, this is a failure or a serious problem here. 28 properties that we've attempted site visits, meaning knocked on the door, left a door hanger saying, please contact us. We're still awaiting that owner contact. Been able to resolve a fair amount of cases, 32 cases so far. Others we have repairs in progress, and 120 are still under investigation because we get new ones all the time. So I would love it if Sherry would go ahead and give us a little story or two about what she's finding out there, unless folks want to do questions first. Go, Sherry.
So one of my most beneficial cases that I've been out on, we received a report back in January indicating that the septic was failing, they needed drain field assessment, and that there was surfacing sewage. So by the time we got it and reviewed it, I went out right away. There was a small amount of standing water. Everything was buried underground, so you couldn't evaluate any of the components. But I was able to speak with the tenants, and they were, indicating that they've known that the septic has been having issues for years. They don't really know a lot about septic systems. For instance, they didn't know that gray water was actually considered sewage. So they thought that it was fine to have, gray water discharge onto the ground surface, and didn't think that that was an issue. They didn't know what steps to take to kind of remedy the situation and how they could fix this. So it was a really good opportunity to be able to explain to them what sewage is, what their system is, and why it's so important for them to fix it. So because we weren't really sure if this was a confirmed failure, we had them mark off the area, and then they said that they were going to be digging up the area to evaluate the inlet baffles, which is what's coming from the house into the tank, and the outlet baffles, which are going to the distribution box and then to the drain field. They were able to dig that up and then found that it was a complete failure. I went out, a few days later to make sure, that this is confirmed septic and that they, a problem and that they needed to fix it immediately. They were able to call out a septic company within days to have them pump it. They were able to replace the outlet baffle and then the transport line going to the distribution box. So all of that was fixed within the matter of less than a week. And in the meantime, we were able to discuss how they could, immediately resolve that public health concern. So water conservation, they were using their RV instead of using the plumbing in the house. They were using disposable utensils instead of using dishwashers, doing laundry, off-site. And then they were taking that RV to an actual approved dump station. So every time that we had a conversation and every time I was able to speak with them over the phone or do a site visit with them, they were still, continuing to improve and learn and be able to take that education and be able to alleviate that concern. And because of the education that we provided, they were able to find that there was old irrigation installed directly over their drain field, directly over their septic tank that was leaking. So that caused the soils to be really, really saturated and most likely was causing the drain field to not be able to take sewage. So everything was, able to be fixed within, less than a week and a half. And, they've already started making steps to save for the inevitability of them needing to replace the septic, and also make those repairs in the meantime. So install access risers to the ground surface to be able to easily evaluate how the system is working. And they're actively trying to do everything that they can, to make sure that this doesn't happen in the future. And if it does, now they have the resources to be able to stop it as soon as possible. So that was one of my, I guess the best ones that I've been on so far. And then from the grant project that we had, another coworker, Morgan, has been sending out letters to those properties that haven't had inspections in, the past 6 years. And so we got a call from a gentleman, over 90. It was located in the Eld Inlet area. And he was indicating that he pumps sewage directly out of the ground. So he takes it out of his septic tank and puts it, 100 feet away. And he didn't understand that that was a problem. So we were able to go out and actually speak with him in person and offer him that education. And, now he's willing to actually hire a septic professional. And we've been able to give him those lists and, move forward with being able to do things the correct way. So it's been really positive and homeowners have been wonderful. And it's been really nice to be able to provide that.
Thank you. So that's all I have on the septic compliance piece. Any questions at this point?
Questions?
No, not at this point.
Commissioner Menser?
No, I'm good, thanks.
Okay, no questions.
So I've got a couple more slides and then we'll see if there's any other questions. So just to remind you or let you know, maybe probably not remind you, I don't think I've talked about this for a while, is that the Nisqually clean water or watershed protection area, which is where we have a septic system monitoring and maintenance program similar to Henderson, is due to expire at the end of next year. When the board adopted it, I guess 8 years ago, they put a 10-year sunset date, and then prior to renewing it, we'll provide information on the success of the program and any recommendations, and then the Board of Health and the Board of County Commissioners, because there's two different actions that need to take place to renew these things, will decide whether it warrants being renewed and if it should be, the conditions should be changed. So to let you know that's coming, and so we're starting to work on that already. You can see that roughly where the area is up here on the Nisqually Reach area, but the watershed itself actually goes back quite a ways. Parkway, for instance, if you're familiar with it, to the Meadows subdivision, that's over here. There's some other areas, down into the Nisqually, the flats area down in the lower part of the watershed. So that's all within the Nisqually watershed protection area. It doesn't include the full watershed because this, when this was set up, we worked with folks to identify the areas where septic systems could be impacting the shoreline area, and this was our best effort at defining those septic systems. And just to let you know, you might have seen one of these maps before. This is a map that we produce. I'll say we, but it's a combination of our Jane and staff, and also working with Joel from IT and with the geodata folks to pull together this map. And it shows the locations of septic systems, and it also shows the ones that have current inspections and those that don't. And green means good in this case. It means they have current inspections. You can see the vast majority of the systems in this watershed area have current inspections. So that's really good news. And as Jane showed with one of the previous slides, in the in the septic systems with those required renewable operational certificates, about 90% of them have current inspections, and that's consistent with what we're seeing here in Nisqually.
Commissioner Menser, 1 second, Art. Commissioner Menser raised his hand.
I could just ask a couple of questions on here. So is that date correct, Art, that it expires in 2 years? Because it says
This expires at the end of next year, correct?
next year. So we've got a whole year to think
We've
about.
got it a whole year. This isn't quite as rushed as we were with Henderson when we had to renew that.
Okay, and then does this come with the same like $42 fee that we keep hearing about on Henderson? Is it the same kind of financing scheme or whatever?
It's the same financing mechanism. It's the rates are little, or the fees are slightly different because of the mix of septic systems, but it's the same concept.
Okay, and then final question, this patchwork of mostly green, which shows a good rate of compliance, is that translate into good results in our ambient water quality testing? I mean, is there a correlation there between good water quality result and this compliance rate? Are those connected?
You want to speak
Somewhat.
to that, Kate? You look like you're ready to say something.
Yeah, so our ambient water quality focuses on streams and lakes. And, you know, all along the shoreline, of course, is direct discharge into Nisqually Reach itself. If you look, the state Department of Health does marine shoreline sampling. Well, not shoreline, marine sampling every month or two for the shellfish compliance. And most of the stations on the northern part of the reach are green. There's a small red area that we've been focusing efforts on, and their Department of Health is looking at that data to consider whether those could be upgraded. When you get down closer to Nisqually Delta, of course, the Nisqually River brings in lots of information, and that area is prohibited for shellfish harvesting. One, because it's a wildlife refuge, but two, because there are some high levels of bacteria offshore there and in the river.
But I guess, but I'd say that the program is working pretty well. Again, this area came about because of a shellfish downgrade, and a lot of that's been taken away. We've had there's one interesting thing years ago where there's one septic system. As it turned, there's a area that got closed right in here, if I'm correct, and it was because one septic system was failing to the stormwater system that discharged at that point. And it took a long time, but we found that thing and got it corrected, and then the water quality improved, and the minor closure area was lifted by Department of Health. So,
Hey, Art, was that one system that caused all that problem?
in that one area, yes, it was one septic system. And it took a lot of work. And it also took a lot of court work. We ended up having to go to have hearings and do all sorts of nasty things to gain compliance. But one septic system resulted in a closure there.
Wow.
Not the whole thing. It wasn't, but that was one example where it was really, we've got that one fixed. The water quality improved. DOH lifted the closure.
Why is it a shellfish protection district in Henderson Inlet and then this watershed protection area in Nisqually, if it's all related to shellfish downgrades and et cetera?
It's kind of a technical thing. So this is part of the shellfish area. Shellfish protection district goes a little bit bigger, but the watershed protection area is the name of the spot where we have the special septic system monitoring and maintenance requirements. So we gave it a separate name, and the boundary is a subset of the whole watershed or the whole shellfish area.
Hey,
The
Art.
shellfish protection district doesn't have the same requirement?
It does. They're modeled after each other. It's just, again, we're trying to come up with a way to name the special septic system area. We changed the name slightly. So
Okay.
it was, trust me, Jane Futterman said it was a good idea.
All right, thank you.
Art, can I do one more?
Yes. Well, I mean, if the board says you can, I don't control this.
How do we stack up against other counties? And I'll just use as an example here, it looks like you've got about 120 systems under investigation all the time, it looks like. I mean, you start with 120, and when you get done, you still have 120 because you have new stuff coming in. And, you know, that ends up being about I don't know, 0.5% of the total number of systems. But how does that stack up with other jurisdictions that are trying to do good? Do you guys get together once in a while and talk about those type of things, or does the State Department of Ecology put out, they might put out that County X is the pits, but you know, County A is better, or that type of thing? Do we have those type of comparisons?
We, and that actually is a bit of a challenge, but we do have, there's a meeting that occurs, I want to say quarterly, that the State Department of Health convenes with the Puget Sound counties. So they talk about successes and problems and who's doing what. And so we can talk about that. I used to be a participant on those, but now it's Jane and Vlad who are kind of attending those. I think Vlad's been doing most of them lately. And so we can do that when we compare the percentage of septic systems that have current inspections. We find out that Thurston County is doing really well. I've shown a slide before that talks about, or that indicates about 40-something%. Anyways, overall, the Puget Sound counties are doing much worse than we are within Henderson and Nisqually.
Okay.
But there's also, if you dive deeply into that, you'll find out that not everybody's measuring it exactly the same way. So one of the challenges that actually is a foundational public health services thing is to look at some of these data sets and make sure that we're looking at we're comparing apples with apples and looking and counting them the same way. Because otherwise we really can't, you don't know who's doing the best. I think that's a really good question. You want to know who's having successful programs and what contributes to those and how much does it cost. And right now that's pretty hard to do.
Okay, thank you.
And I think Stuart can speak to that because he's worked in 2 other counties that have had different approaches on this. But that I think is a challenge, and frankly it's been a frustration for some of us for a while.
Hey, when you have one of those meetings, could you, I don't know, let us know as commissioners that there's a meeting? I don't know if it's open up to that type of a thing, and I don't know as I'd be able to go to it, but it'd be kind of interesting to go to one of those meetings and kind of.
I can tell you when they are, and then I think there's also coming up, I don't know, there's usually once a year or so, especially now that COVID is backing off some, once a year, there's a pollution identification and correction meeting that takes place. There's also other things that might be of interest, but there are a lot of counties that are doing some really interesting things. I think we've been doing pretty well, and I think with some of the new ideas we have with our new staff and what we're learning from others, I think we can make it better. Again, then that's actually kind of one of the next things I'm going to talk about is that, just a reminder, you've seen this slide before that shows that when you look at areas like Henderson and Nisqually, it may not be a huge percentage, but we do find failing septic systems. And as Commissioner Edwards highlighted when we were talking about failures, one system in the wrong place that's discharging to surface water can cause a problem. It can result in a closure. We'd have documented cases where failing septic systems have caused illness. There's a case in Thurston County. There was a couple of really classic cases in Mason County where they were actually able to trace using some pretty sophisticated microbiology stuff, be able to show that the stuff.
Art, time check.
Okay, really quick. So anyways, that's important, but what we're doing now is evaluating options for Nisqually. This column shows what our current program entails. We've got routine dye tracing and things, but based on what we've been learning and based on the experiences of others, we're going to look to see if there might be some other ways to approach this. So that's going to be happening in the next months. And when we come back to you with a briefing more specifically about Nisqually, we'll be talking about, do we want to stay what we're doing? Do we want to tinker with things? We want to do something else? I can assure you that based on the success of the program, we want to I think we'll want to continue it, but it may be a little bit different. We want to take advantage of what others have learned with the experiences of our staff, of Stuart and others, to see if there might be a better way to do things, or is it maybe a more efficient way that's cost less. We don't know what the future holds, but we want to let you know that it's coming. The future is coming, and we're going to be talking to you about this quality. And so that's it. So sorry we were running a little bit long.
Thank you, Art. Okay, commissioners. If there's no additional comments, I know that we are over. Okay, we're adjourned. Thank you.
Best septic briefing ever. Thank you.
Oh, yeah.
Good job. Good job.